My name is Dr. Moniodis. I am a board-certified pulmonologist, and I specialize in pulmonary hypertension. As long as I can remember, anything that had to do with health was interesting to me, from reading my dad's encyclopedias to attending my grandparents' doctor's appointments with them. And when I realized that I could take that interest and make it into my day-to-day, my career, it didn't take a second thought. I love using science and health knowledge to help people on a daily basis. I specialize in pulmonary hypertension, so the patients I see are those who have an existing diagnosis of pulmonary hypertension or a suspicion of a diagnosis of pulmonary hypertension. So for those existing patients, I help treat and manage their medications, and for those who don't have a diagnosis but may have one, I help direct finding out if that is the case. Within that population, patients who have pulmonary hypertension related to lung disease, specifically interstitial lung disease or COPD or chronic obstructive pulmonary disease, I have a special interest in that population. I'm lucky to be a part of a combined clinic, so it's both myself, a pulmonologist, and Dr. Thomas, who's a cardiologist, and we work together in the clinic seeing patients at the same time and have a conversation in real time between us and with the patient to discuss how the heart and the lungs work together for the diagnosis. It's great for me. I learn from him, he learns from me, and we can make the patient experience much more streamlined and hopefully better all around. I think having respect for the patient is number one. When patients come into a visit, often they have their own questions and concerns, and I think those are the most important to address first. And then there are other issues that are on my list of things to do, and we'll work through those together. And I will have the respect for the patient that they have opinions and preferences. And so knowing that it's a collaborative visit and having that mutual respect is essential. Yeah, and I think being a pulmonologist has been a very interesting type of physician to be over the last 3 years. There was the pandemic. I took care of many patients with COVID firsthand in the intensive care units, and there was a lot of questions about what do we do, what does this look like on the other side, and to have been able to be in the thick of it and then now see patients on the other side who were sick and who are doing better, or who were sick or on their way to feeling better, it makes me feel that my role as a pulmonologist really has been one with a lot of meaning.